Okay, so hi, my name is Matilde, and I'm going to talk to you about government miscommunication and how this might have impacted vaccine rates. So firstly, I'm going to explain why vaccine hesitancy is a problem and its determinants. Then I'm going to go through how I came up with my study hypothesis, followed by looking at arguments for my hypothesis, comparing the actions between governments, analyzing any other possible causes for vaccine hesitancy and their validity, and I'm going to end with what can be done to improve our current situation. So, as you're probably aware, COVID-19 was first identified in China, and vaccines were produced in the same year to mitigate its effects. However, some communities felt hesitant to take them. Sage described this phenomenon as a delay in acceptance or refusal of vaccination despite the availability of vaccination services. According to another one of their studies, this hesitancy is determined by complacency, convenience, and confidence, which you can see in the diagram here below. And the last one, confidence, is referring to the trust people have in the vaccines, their manufacturers, and decision makers like the government. It was also noted in the same study that poor communication is capable of reducing vaccination uptake and cause the development of vaccine hesitancy. Therefore, it was because of this that I decided to investigate whether the UK government, as a result of its communication, had any part to blame in decreasing the public's confidence in the COVID-19 vaccines. And to do this, I identified pertinent themes from the articles I studied to really get a grasp on the different factors that might have influenced vaccination uptakes. I found that apart from government miscommunication, there were individual predictors, science of vaccines, religion, ethnicity, and media, with a focus on conspiracy theories as well, which you can see also on the table below. So there were many faults found involving the government's communication, and some of these regarded how, for example, the government underestimated the pandemic and referred to the present phase as post-pandemic recovery, which I think David Church also referred to during our presentation. Their introduction of vaccine passports and other stringent measures that were quick to be labeled as violations of freedom, the postponing of the joint COVID-19 and flu autumn booster vaccination campaign, which was responsible for putting even more pressure on the NHS, their handling of funerals for those deceased from COVID-19 that was described as traumatic by grieving relatives and friends, and their own cooperation regarding the COVID-19 inquiry, which has been on the news all over at the minute, and how there were inconsistencies with their policy and position and several divergences between the measures taken by foreign governments, which reduced the relevance of vaccines. And lastly, how they primarily chose unfamiliar scientists or faces to incentivize people to get vaccinated instead of individuals who are relatable, respected, and recognized by hesitant communities, and who therefore would be able to greatly engage with them by, for example, using empathetic and impassionate anecdotes. So all of these essentially caused the public to believe it's unnecessary, and at the same time that they were being forced to get immunized. It reinforced individualistic thinking, it further segregated society, negatively influenced confidence in the NHS and therefore in the professionals who delivered the vaccines, instigated uncertainty and confusion over the government's advice, and consequently disengaged people from their vaccination campaigns. There were lots of disparities between the way New Zealand handled the pandemic compared to the way the UK did, and these were translated into their consequences. So New Zealand was considered one of the most successful countries regarding their control of the pandemic. And people believe this was because of the Kiwis' early immunization coverage and the manner that their government invited people to get protected from COVID-19. Whereas the UK decided, for example, to scaremonger and guilt-trip vaccine-hesitant individuals by putting up reproachful and accusatory notices, such as the ones below, which you can read say, "Don't let a coffee cost lives," and, for example, look him in the eyes and tell him the risk isn't real. Other disparities between the communication of these governments are listed on this table here. New Zealand focused on protecting their population's human rights instead of restricting them, whilst the UK consistently introduced more austere measures. The Kiwis expressed their commitment to equity and partnership, which is the foundation of their constitutional documents, Te Tiriti o Waitangi, with their minorities, like the Maori, in their COVID-19 response. This commitment incited initiatives that explored vaccination training of the Maori and the translation of COVID-19 health information into the Maori language, whereas the UK failed to connect to their ethnic communities. The New Zealand government also launched a website called Unite Against COVID-19, where they offered advice and posted factually verified information concerning the virus, protecting their population from any confusion distinctly felt by the British population. And lastly, because their Prime Minister, Jacinda Ardern, related about COVID-19 cautiously, people saw her as an honest leader, which contrasted with the perceived distrust received by the UK government. Regarding other possible causes for the low vaccination rates felt by the UK, I found these could be due to people being of the female gender, of a lower socioeconomic status and age, and of having a low risk perception regarding the virus. Scientists being seen as secular, disagreements with religious dogma, and misinformed pastoring were also found to be religious causes for vaccine hesitancy. Echo chambers occurring in the media and promulgation of previous vaccination scandals and the disinformation that aroused from them equally led to apprehension. Vaccine hesitancy was also attributed to the brief development process of the vaccines and the insufficient evidence available for the efficacy. And stern UK governmental policies that induce prevailing inequalities in minority groups, along with the long history of institutional racism, might have also prompted skepticism for medical authorities, augmenting misinformation beliefs. And the last one, conspiracy theories, were found to have the greatest effect in reducing vaccination willingness. And these are thought to be credible because believers identified incongruities in the succession of the COVID-19 outbreak and tried to make sense of them. However, some studies contrasted with these arguments. So, for example, although the efficacy of local representatives encouraging COVID-19 vaccination has been demonstrated in several studies, a few articles still appertain to the trust the public feels for scientists and vindicate that viral news and advice ought not to be given out by governmental employees from a scientific language to a simplified common one for public accessibility. And additionally, just as the media can spread viral COVID-19 vaccine disinformation, it can equally spread accurate vaccination facts. Some articles argue that vaccination rate increase is also feasible with the publicizing of governmental proceedings like those of COBRA meetings that emphasize the gravity of the pandemic and triggered a perceived elevation in the vulnerability felt by the public. So in conclusion, I think it can be confirmed that vaccination uncertainty has many components, but that government miscommunication can critically compromise public confidence, which is one of the three fundamental factors of vaccine hesitancy. And that essentially, I believe that the government needs to engage minorities in vaccination campaigns, transmit transparency and compassion in its communications, and attend to public concerns to grab the attention of the public and to, most importantly, attain its trust. These are just some of the references that I used in my study, if you want to take a look at them. And yeah, thank you very much for listening. Thank you.
Thank you very much, Matilde. That was a very, very good presentation. I think the whole issue of what was going on in New Zealand was fascinating. I had a friend who I was in touch with throughout the pandemic, and they just loved their Prime Minister, whereas we didn't, which is interesting. Anyway, so we've got a few minutes for questions for Matilde. Anybody want to ask the question? I think it just makes me think of everything that you've done, Matilde, should be as evidence to the COVID-19 inquiry. I think it's just very succinct and devastating, isn't it?
Absolutely, yeah.
Steve, do you want to?
Yeah, hi. Yeah, brilliant presentation. Thank you very much. And that goes to all of you. I was a vaccine volunteer shepherding people in for their vaccinations, and it was absolutely remarkable how the first tranche of people who I think were the over 75s came down and got their vaccine with a huge sigh of relief. They had tremendous buy-in to the idea of the vaccine and that. And then, of course, there were issues with sort of younger people, particularly the Oxford vaccine and, effects with blood disorders that were found later on. And actually, you mentioned that maybe the science should be sort of broadcast more widely. But at that time it was, and it was kind of confusing because we were told about the balance of risks, from the I can't remember what they're called, the vaccination committee. I can't remember what their name is, but basically they were getting to the point where it was looking slightly more risky to be vaccinated than not. So that is just going to stick as something that's hesitant, if you like. But I think more important moving forward is the fact that parents are choosing not to get their children vaccinated against, quite serious diseases. And I think there's still a hangover there from that doctor from 20 odd years ago who claimed that the MMR was a cause of autism. And no parent is going to want to subject their child to things like that. So I still struggle to find how a really positive message can be got over unless you've got a pandemic on your hands and there's this magical solution hanging on the Christmas tree, if you like. So I wondered if you had any further comments on that.
I think there are several components to that question. I think I read in an article that elderly people are more likely to get vaccinated just because they've witnessed other viruses and how vaccines can actually help them get protected. Also, they've been more educated. They just have a higher risk perception of their susceptibility towards the virus. So, in order to prevent that, they would like to get vaccinated. I've also read articles about how parents aren't as likely to get children vaccinated because of previous scandals with vaccination, such as the MMR vaccine, which was coupled with autism. I think that was published in the Lancet in 2000, I think. I'm not too sure. But yeah, I think the media can definitely, harm vaccination rates because of that. But like I said, it can also improve vaccination rates by telling people about the gravity of the pandemic and their situation, by reporting how many people are getting COVID and how it's affecting them, and about what the government is doing at the minute, so people can realize that their risk towards COVID-19 is actually quite big. But yeah, I think by educating the public and by really targeting vaccine hesitant communities, we could really bring vaccination rates up. Yeah.
Great, thanks, Matilde.